Hi, this is Ron. Back to see you. AthleticTuneUp.com. That's me. Today, I'm with Sanella. She's also a yoga instructor. Say hi. She's face down. So she has a problem with her back today, upper back, what a lot of people have. Upper back between the shoulder blades. So we're going to work on that today and show you how you can release it and get some relief. And maybe if you're having a lot of problems with it, give you some ideas for your therapist or whoever is working on you, and we'll see what we can do. All right, so here, she's having a problem here. Is this correct? Yes. So this is not where I'm going to work. This is just the result of her problem. So a lot of the problem is going to be here. These muscles in here constrict together and they pull on this area. So this also relates to the front, but we're going to work on this area here first. So just a little bit of anatomy here. The rhomboids connect here, connect to the spine, and so everything's kind of pulling. So we're gonna try to release this to go back. So the scapula here, there's a muscle here called the infraspinatus. So we're gonna kind of release this from the tip of it, and this goes all the way up to the shoulder. So we're gonna kind of do this. Break it down, massage. Feels good, huh? So on the scapula, you also have the teres major, which is right in here. Yeah. And then the teres minor, which is right in here, which is another one you get. So a good way to get that is to kind of open it up, get the scapula on the edge, and hit right in there. So right in there. So you can do a little bit of movement here to kind of help all that. At the same time, I can come up and hit the infraspinatus right there. Because once we get the movement, the muscle will relax. Then not only that, your triceps attach up to the scapula as well. So your triceps go from here all the way down to the elbow. So massaging this here. So doing yoga and other chest press exercises, you put stress on the front, and the front just pulls everything forward. So we want to get this all release. Yeah, so just kind of getting the tricep moving here, getting the muscle moving, working my way up to the area here. So another muscle that comes up in here is your lats. Lats attach right up in here, but come down all the way down to the pelvis. So a lot of pull-ups for you CrossFitters, yoga, downward dog. Who else? A lot of who else does stuff like that? Anyway, YouTube mainly. Gymnast. You're gonna get those lats to release too. In here. Ooh. Another thing you can look for when you're working this area is the rib. The rib could be out here. So you can always go in there and check. Sometimes just kind of rotate it. And usually you can tell if they're at shortness of breath. But she's not, so the ribs are going to be okay, but I like to check anyway. Man, that's all. You need some love on this. Yeah, all this right here. So it goes all the way to the edge here. All right, so now we're gonna turn on her side position and show you a different way to get this. All right, now we're on the side position. So this way I can get a little bit of both the front and the back at the same time and get more. And also, I want to get the serratus that attaches along the rib cage here. So you have the serratus muscles here, then you have the lats, which attach from here, down here, and all the way down to the pelvis. So what I like to do is get the serratus, which is right under the scapula, and kind of get some movement here, because that allows her to get her range of motion back on overhead activities. Yeah, right in there. It's a good spot. Don't you agree? And then I could also get some anteriors as well by my thumb right here. So, and then the tricep, and I said the attachment here for the lats, and the anteriors muscle goes right in here as well. So we can kind of get that too. And then I can start getting the pec minor, which goes along here, which is the third, fourth, and fifth rib, where it attaches and attaches up in here. So kind of getting, yeah, right in there. So let's get some movement going on here. Yeah, hit a spot. And so now I'm just kind of getting the scapula to move, because the mobility is important. Right there, got a good spot here. So there's not much pressure because it's dealing with the rib cage. Just gotta find that muscle and just try to move it, and it will eventually. Her breathing helps. So I tell my clients either breathe or pass out. Obviously she's not passed out, so she has to breathe. So now she's got some good movement here. I still get some of the infraspinatus. She's got some anteriors, a little bit of the delt. And then I like to check all along the back here where the lats go to see where I may want to work again. Yeah, that's for the lower back. So this also affects the lower back as well. This little shoulder thing is affected from the hip. So now we're gonna go on the back side. So the pec minor, like I was saying, it attaches to the third, fourth, and fifth rib, which the fourth rib goes under the nipple. And anyway, so I'm gonna go under, right? So start here, hit the third one there, and attach there, yeah. So you just lightly moving it, getting some range of motion back in that muscle. And then you can kind of open up a little bit here. You can kind of strum them, all three of them here. They attach up in the shoulder here. And then I can also grab here, hold it, and pull. So all that. And then you check the, so the sternum, which is here, the rib cage attaches to the sternum and also attaches to the spine. So when the muscles are pulling from the back to the front, you're pulling on the, you're hunching over. So what happens is the sternum here, ribs here, what happens is they kind of overlap. And so they kind of get stuck. And so what I have to do is go in there and break that up. Let the rib cage kind of relax. Because it should be smooth up and down here. And so slightly massaging little scar tissue out. Tension right there. There's ligaments in here. Yeah, that's pretty good, right? Yeah, some of you may be really sore because you might be really tight. A lot of people are so hunched over that it's so tight. But this is just not too bad. But I can follow that rib here. That's being pulled as well. And then here, stretching, opening up the rib cage here. 1, 2, 3 here. right under the clavicle. So I'm stretching out the ribs here. So right under the clavicle, just kind of moving it, stretching it. While she breathes, the ribs expand and they relax. There you go. I can check both sides here. Kind of make sure there's some mobility here. Good. All right, and now the top of the shoulder here. So you have a clavicle that comes in here, attaches here, and then your scapula also comes together. Well, they should not touch, okay? So hers kind of touches. A lot of times this happens from sleeping on it, from doing a lot of overhead stuff. Who knows how it really happens. But I'm going to release the area in between the scapula and the clavicle, which is right here. Right here. Yeah. And so the rotator cuff all attaches in this area. You have the infraspinatus attaches here. Then you got the supraspinatus up in here. Subscap, which is right here, right below the bicep, attaches there. Yeah. Then the bicep comes across as well. Bicep also has to do with this, and that's another video with the wrist. Anyway, rotator cuff. So you want to get these muscles moving here. By me holding it down and rotating the arm, I can find her spot. Yeah. And then right in here, try to release this right there. And it's a small area, a crease there, it causes a lot of problems. Yeah. Feel okay? Yeah. All right. So that's all that, and then I want to stretch back, stretch the Pec Minor, open the chest up, get the shoulder back, and then I can stretch the scapula by pressing down, holding it, pulling the arm over, stretching. Yeah. Feels good, right? Yeah. And then I can shake it out. Right, the bicep needs to move as well as the tricep. You know, it comes down in here. All right, now kind of move your arm. How's that feel there? A lot better, right? Okay, now when she's done that, have her put her arms down and tell her to squeeze her shoulder blades together. Squeeze, there you go, relax. So what that does helps her body to learn how to use the rhomboid muscles. Great job, thank you. Please subscribe, thumbs up. Hope you like my new assistant here, Sanella. And she has a video, yoga video herself. So look for Sanella's video, yoga videos. And oh yeah, favorite my video. Let me know what you think. Have any questions, email me. Any video requests, anything you guys want to see. Follow me on Facebook, Twitter, Instagram, YouTube. Whatever. Good to see you. Out.